Hello. Today's presentation continues our series of workshops with the UCSF Memory and Aging Center, Our speaker is Gloria Aguirre, Community Engagement Manager for the Community Outreach Program at Memory and Aging. She's also the Artistic Director for Creative Minds, which is the Community Arts for Brain Health initiative in San Francisco. Gloria is originally from Miami, Florida, and she is committed to improving brain health literacy in the community through arts, wellness, and education programs. Gloria is currently an Atlantic Fellow for Health Equity at the George Washington University. We want to thank you, Gloria, for coordinating this series of workshops, and welcome.
Orla, thank you so much for that very kind introduction, and Louis as well for all of our work together throughout the series. It's really a pleasure and honor to be here with you all this morning. So thank you for the invitation. I do work for the Memory and Aging Center at UCSF in San Francisco. And part of our community outreach program is this program called Creative Minds, where we think really critically about how we can engage in different neighborhoods across the city that are generally considered underserved, and how we might focus on education, wellness, and different creative opportunities and projects. So thank you for having me. I mentioned that because as an artist and somebody who's really focused on community engagement, this session might feel a little bit different than some of the other ones that attendees have joined so far in the series. And I'll ask you to just go along for the ride with me a bit, and we'll think a little bit differently about how circumstances in our neighborhoods and lived experiences may contribute to brain health. With that, I will share my screen. And I also should mention briefly before doing that some of the images, there's a lot of photography and images in this presentation. So some of them may be a little bit triggering or difficult to view. I'll try to mention when I see something coming up or I'm aware of a particularly troubling image, but I will say that as a blanket statement at the beginning, there may be some images that you may even find a bit offensive, but they're all public, images that were taken in public places in San Francisco, or maybe news articles or have been reported on in the media. So no private or very personal photos here, but hopefully something that will spark some critical thinking. So I will share my screen. Let's see, and go into presentation mode. I think we should be set there. So to bring this to sort of the root of a lot of our community and education tech brain health over the life course, an important aspect of that is social connection. And so thinking about this a little bit differently, I often reflect on what circumstances promote community engagement and which may have us withdraw a bit more from our communities. And so thinking about NeuroNose, which is this series that you may have been participating in over the last few weeks, and really focuses on toxicants or chemicals and different particles in the air or other lived environments that might affect our brain health. I also think about sort of the settings and places where we're living and congregating. And in addition to those chemicals and toxicants that might be in those environments, what else is affecting our brain health? Social connection being a really huge and positive driver of cognitive health over the aging process. And part of that is just sort of the simple conversation, right? And I say that, I usually say that to spark a conversation in these sessions, but I'll say that if you have a comment or something that you see brings up a question, please do submit that in the chat. And when I mention conversation, what I hope to get to is the point that really in conversation with another person, we have no idea what they're going to say or think or ask at any particular moment. And so that's really a challenge and a workout for our brains every day. And if we're thinking of small things that we can do that kind of build up over time, the same way that you might think about how you take care of your heart or a leg injury or a cut that maybe needs some cleaning and a Band-Aid, There really are these small things that we can do to protect ourselves and one another. So I start with this photo. This is the picture of a street in San Francisco, just kind of to think about what are the streets looking like. And this was taken earlier in the pandemic. I know that, there are a lot of sort of ways that we talk about this now, whether we're post-pandemic or still in the pandemic. But you can see really nobody on the street, but a lot of trash and waste. And we think a lot, about fungus and bacteria and chemicals. And many times in circumstances like this, we'll end up seeing even fires where people are burning the waste, right? And the trash and trying to get rid of it that way. So I posed the question, and I find this to be particularly interesting because I would imagine that we're joining from sort of all over the city or even the broader Bay Area. When you walk outside of your home, what do you find on the streets of your neighborhood, right? What does it look like? I'll share an example from myself that I think is a little bit eye-opening when we think about the contrast between sort of the surface view of something and what it really represents. I live in the Mission neighborhood of San Francisco, and there was a period of time where there were a larger group of unhoused individuals who were kind of living in the neighborhood around in the blocks around where I happen to live. And over time, what I started to see was that, they were living on the sidewalks next to buildings. And over time, what you would see is big planters. And they slowly started placing them in the middle of the sidewalks and in these strategic places that essentially make it very impossible or uncomfortable to set up a tent or any other sort of stable living circumstance outside. And so I was walking through the neighborhood with someone who was visiting, and they said, like, "Oh, what beautiful planters. These are so gorgeous. You live in such a nice neighborhood." And I thought to myself, yeah, they are beautiful planters. It's true. But ultimately, what they represent is that somebody was living here unhoused and then was pushed out of this place where they happened to find safety or comfort or stability for the day or night. And now these planters are here. So how beautiful are they really, right? And what does that represent? If we think about walking out onto the street and seeing drug paraphernalia or trash, that's going to bring up a whole other set of questions, right? And sort of different experiences to reflect on. And so in thinking about how all of that comes together, I think that it's really important to consider how that gets cleaned up, what those, sort of trash piles and encampments and all of the things that we find on our streets, even feces, we'll get there. So I'm sorry to say, but we will be talking about poop a little bit, for lack of a better way of saying it. All of these things, right, have chemicals and bacteria and materials that they were constructed out of. And so when they get swept up, when they get burned, when they get moved, what's happening? What are those particles that are going into the air? And aside from those particles, how is it affecting our mental health and our desire to engage in the community? The unhoused situation in San Francisco and Oakland and in many parts of the Bay Area and the country, frankly, has been very challenging to address, as we all know. And so this is a view of triage center, View Hunter, and it's a picture of basically where this section of the park was blocked off so that RVs and other vehicles could park there and have a place to stay stably and have the inhabitants, have sort of a place to go without having to move constantly or be in violation of parking or other regulations in the city. So what does this represent, right? What are sort of the two views of this? For the folks who are experiencing homelessness and maybe are living in one of these vehicles or based in those vehicles, it represents a safe place to park and somewhere where hopefully they won't be bothered and won't incur any fees and such as that. For families and people who live in this neighborhood and who frequent that park, it becomes sort of a concentrated place where there is a lot of trash that's not picked up or managed well, where there may be sort of a deterioration of the circumstances surrounding typical park and recreation, thinking of comments that I from community who bring anymore, I won't. And thinking about that thread, right, between social connection, between healthy aging, between community, between conversations and being engaged rather than sort of isolating. These changes can really, really build up and produce an effect in the lives of individuals and communities. And that's something that I've heard from folks. It's not something that I'm assuming or sort of thinking about on my own. This is one of those photos that's less pleasant for sure, but how many of us have been in San Francisco and seen something like this, right? Where we know there are public restrooms, we know that there are some places, though they're difficult to come across at times, where private needs can be taken care of. But a lot of times that ends up happening in the street here. And what does that mean? What does that mean when a child is walking to school, or when someone who uses a walker or a cane or even a wheelchair is trying to get through the sidewalk to get to a medical appointment, or some other errand that they need to run, go buy food? This is a quote from an article that was placed on the NBC sort of website here for the Bay Area, and thinking about, what do you tell children, right, when you're walking down the street and they see feces and they see paraphernalia? How do you explain that? And on the bottom right corner of this slide, what you see is sort of a highlight of the Tenderloin neighborhood in San Francisco. The Tenderloin gets a lot of publicity about this kind of stuff, but I would say that I've seen it just as prevalent in other parts of the city, including in the Mission, in some sort of parts of it. And what this does, based on this heat map, the orange to red, is kind of show the concentration of where some of these, reports of feces on the street or paraphernalia have been found. And so we can see there's really a high concentration on certain streets, and those streets also have schools and apartment buildings and banks and grocery stores, right? Again, thinking about sort of that play between surface and the true effects that are maybe a little bit deeper, thinking about may actually have big effects. I think about children again. And when you're a child, a lot of sort of development happens through exploration, right? I'm not a pediatrician. I'm certainly not an expert on child development, but what I know about it is certainly that there's a lot of exploration, there's a lot of touching and tactile experiences, hopefully a lot of curiosity in that growth. And in reading about sort of, the history of some of these issues in San Francisco, some years ago, I was reading about why there were no more sandboxes in San Francisco. And the takeaway that I had after looking into this further was really that because of feces and drug paraphernalia that was frequently found in sandboxes in different parks throughout the city just decided to take them out of parks. It became too expensive to maintain. It became too much of a liability. And frankly, parents, I would assume, are less likely to bring their kids to a park where those circumstances exist, because it's dangerous, right? Health-wise, mental health aside. So how does that then generationally really have an effect? It may sound like something really simple, like, oh, a sandbox. But when we think about how so many different parts of everyday life are affected by circumstances that have a shared effect, whether you're living in homelessness, whether you're walking on a street that has trash, whether you see feces on the road or not, it's sort of these little bits and pieces that come together in our neighborhoods and communities that will either promote engagement, I think, or promote isolation, or sort of saying, I'm not going to go out today, or I'm not going to walk down that street. This is a graph. I think this all got a lot of news a few years ago where folks started reporting through different apps and through, I want to say, Public Works. Yeah, this is from Public Works of San Francisco. There was a way to report sort of where were you finding, feces on the street that had not been cleaned up. There were some sort of comical, maybe, approaches to this, where the tech community got into it and created some applications, and you could snap a picture and upload it. But some of these numbers, and so it gets to be kind of silly sometimes because of the way that the information is presented. But when we look at some of these numbers in 153 city blocks, right, trash on every corner, which maybe isn't that surprising. I think we'd have to ask ourselves critically what counted as trash. Was it just like a napkin could count as trash, or are we talking about piles and sort of buildup of other types of garbage that would not be typical on a city block that you would say is probably like well maintained or cleaned? Discarded and used needles, which present a whole host of hazards, right? Bloodborne illnesses, all kinds of infection potentials. And then, of course, the feces. So when we think in 153 blocks, if all of this is happening, and that's not even sort of the action or movement of the community of the neighborhood, again, I ask you to think about how that might affect brain health, not only from the perspective of chemicals and particles in the air or environment, or that we may ingest, right? I mean, a lot of people have the terrible habit, and myself included, of touching their face frequently, rubbing their nose or eyes. And so how do these bacteria and different materials get into our bodies and have an effect on our health in a way that may be even different than the mental health part of it? In 2018, I come to these points because I think that, again, there's sort of this cyclical way that these circumstances have a huge effect on our communities. And in 2018, San Francisco set up sort of a patrol or a unit of people who would be dispatched throughout the city very early in the morning, usually 3 or 4 o'clock in the morning, and sort of hose down the city, right? And I'm sure this is something that many of us have seen. They're in these huge suits with these respirators on, right? And gloves and heavy boots. And I assume, I've not asked them, but I think that's probably so that they're not breathing in the chemicals, and that those chemicals aren't touching their skin or really getting close to their bodies. But they're often doing this in places where human beings are also physically very near. And I say that having seen it at BART stations very frequently. And you can smell it. I have a poor sense of smell, but others who I've walked with can really smell it. And I think for me, what happens is like this burning in my nose that indicates to me there's something in the air that's not just, typical air, if we want to think of it that way, or fresh air, that I'm breathing that's not making me feel so great. And so if it takes a worker this type of uniform and protection to go out and do this sort of cleanup, what is that leaving behind in the places that they've technically cleaned up, right? And that's not a criticism on the city. I think that they're doing, what they can and trying to manage the situation as best as possible. But we do need to think a bit about the long-term effects of these chemicals in our communities, how they seep into the waterways. And then think about the cost of it, right? So if as of 2018, we're budgeting $70 million for street cleaning of this nature, that's a lot. That's a lot of a city budget. I know that San Francisco is a very resourced place, and we're really lucky in that sense, but how much more could we be doing with that money, right? If it were invested in community centers and health centers and clinics. I think that we could all think of many reasons and ways that this money could be used differently if we were able to fix these circumstances a bit. This is a quote that I found particularly striking. from the Director of Public Works back in 2018. And it's just speaking to this issue really around finances, right? And thinking about when the street is cleaned up in that way and hosed down and looking better, how long does that really last? What effect does that have? And it seems that a few hours later, in many of these circumstances, somebody else from the city will go back and survey or see the same space, and it looks like nothing was ever done. So imagine sort of how defeating that must be to make such a big effort to put in so much money into managing these environments, and then see that very quickly they revert back to what they were when you first arrived in the dark at 4 o'clock in the morning. And I think that when we think from a community perspective about how we address these issues together and the effects that they're having on our lives, we really have to be able to speak to the issue from different perspectives. So whether it's financial, whether it's my individual health, whether it's the health and wellness of children and those who are growing and developing, whether it's a mental health issue, there are so many reasons that we need to be thinking about this together. A lot of times, and a lot of these conversations that I've been in, what I hear from others is that this is the fault of people experiencing homelessness, right? And we'll hear comments about, if they would just get out of the city, and why don't we do this with them, whoever them are? And, many solutions that may temporarily make us feel better, just kind of venting or saying whatever comes to mind. They might sound good on the surface again. And it often probably feels good to blame somebody for something we don't like. But I think that sometimes also propagates myths and sort of thinking that are not helpful to us finding solutions together. There is a point in time, PIT, I think is the way that is the acronym, but a point in time survey basically is one day out of the year, it's a night, it happens overnight, where city workers and others who are organized will go out and survey how many people they can find who are experiencing homelessness in a specific area. And it happens all across the United States. And it's basically the best attempt possible to get a census of how many people are living unhoused. And I think that's something that I've heard a lot from folks here in San Francisco is like, why do people come to California to be homeless? Why, if all of these people didn't come here, then we probably wouldn't have these problems. And the 2019 survey that was completed really dispelled this and showed us that 70% of the people who were experiencing homelessness in San Francisco had already been living here. And many of them had already been living here over, 55% is a significant portion for more than 10 years. So they're not new. I myself haven't even lived in San Francisco for 10 years. I've lived here about 5. So, how do those myths also contribute to whether or not we're able to make progress together on some of these issues? The distinction on top, the sheltered versus unsheltered population, that's speaking to sort of, it may make sense just from the words, but, of course, there is a large shelter system, and there are folks who do not have a permanent, address, who don't have a home of their own, but may stay with friends, families, relatives, and kind of piece together their living style based on that. But unhoused or unsheltered, really unsheltered, excuse me, is the term, would mean people who are, there are a few different terms, but like rough sleepers or folks who are really living outdoors. There is no physical shelter like a car or building where they're staying. And San Francisco, from the data that I've most recently seen, and there may be newer data, but thinking to what I saw from about a year ago, was the city with the highest number of unsheltered homeless. So that makes a big difference, right? And it speaks to something that we'll get to and touch on briefly now. The photograph that you see here, and this was very intentional in me choosing this one, is a picture of someone sweeping, right? And I think we've probably all seen this too, is like, why is he sweeping outside? Or some of these questions that come to mind of how much are you going to clean up? when much of the circumstances around whether your area is clean or dirty don't have to do with you because they're outside, right? Like trash, dust, all those things accumulate despite whatever we might do. And I think that this is important because it speaks to one of the other questions that we often ask ourselves is like, how did we get here? And similar to how did we get here with such a large unsheltered population, but thinking about when we see people, let's see, I'm gonna advance a little bit. No, I'll go back. Sorry about that. I was trying to, there was another slide I thought followed this immediately, but it must be later on. What I'm thinking of though is sort of the loss of distaste and disgust. There's a certain part of our brain that focuses on that, right? On telling me like, this is dirty, I shouldn't eat it, or that's a very rude comment, I shouldn't say it. It's an inhibitory response. And it is sort of this disgust measure, right? I wouldn't go into a trash can to try to find food, no matter how hungry I am, because it's not about the physical hunger. It's this mental space where we know that's disgusting, for lack of a better vocabulary. So sometimes when we see people living in rough circumstances and who are unsheltered, homeless, we may see them really living in circumstances that are quite dirty, right? A lot of trash, maybe rotten food, sometimes even waste, human waste, very close to their physical surroundings. And it's one of those brain changes that often indicates to neurologists and other clinicians that something's going on that's not typical. It's not part of the typical aging process. It's not part of another typical disease process. We would normally maintain these inhibitory responses or sort of sense of disgust and distaste throughout the life course if we're aging healthily and there aren't some of these concerning processes happening in the brain. And so it's not to say that someone who loses their sense of inhibition or disgust is experiencing neurodegenerative disease. It's not a 1 + 1 = 2 equation like that almost ever with any symptom. But what I can say is it's one of those things that tends to stand out. And when I'm thinking about some of the work that the investigators in our research center at the Memory and Aging Center do in working specifically with people experiencing homelessness, this is one of those questions, right? Like, how is it that folks are ending up on the street? Is it really a mental health problem? Is it really a drug problem? Or is there something else that's contributing there? And particularly in the context of aging, of an aging society, of baby boomers, aging and sort of large sections of our population. Is that sort of one of these unknown or unspoken about circumstances that contributes? Thinking a little bit further about what's in the air, what's in our environments, how some of these neurotoxicants that may affect our physical brain health, and I mean like the actual neurons in our brains, right? Not how we're feeling, so mental health, but more function based on what's up there and what's functioning well. This is a photograph from a waste facility. I bring this up because, of course, trash facilities, factories, concentrations of industry often produce higher concentrations of these types of chemicals and waste products, often that go in the water. And I won't repeat a lot of what's already been mentioned in previous sessions with Dr. Winden or Dr. Pina. But I think that it's important from an equity perspective to see how this might function and how, it contributes to different communities and how much we get out into those neighborhoods. This is a map of the city of San Francisco, and I focus mostly on San Francisco because I live here and it's sort of this hub for many things that happen in the Bay Area. But this is a statewide database, and you can look up any census tract or area in the state. And what it's doing is looking at waste processing facilities, right? So these little orange squares are either trash processing factories or, similar to the photo that I just shared, animal waste, chemical waste, any different type of solid waste. And you'll notice that there is a high concentration of these facilities in Bayview Hunters Point, right? And we know that that's a neighborhood in San Francisco that historically has seen a lot of waste, nuclear waste, way back in the day, a lot of waste from butchers and other sort of industries that existed there. And that trend hasn't changed over time. If anything, it's gotten maybe worse in some ways, with these waste processing facilities concentrated very much in these neighborhoods. And if you look closely, I won't be able to zoom in presentation mode, but these streets, Carroll Avenue and Candlestick Park, these are all residential areas. So it's having a trash or waste facility that's emitting those chemicals and waste products and smells too. I don't have a very strong sense of smell, but that's a big part of this, into the air constantly, in a place where we would hope our families are living and growing and thriving. And how might that affect our desire to be in that community, but how might it also affect what we're breathing in or what we're consuming? Even sort of what dirt or particles come in on our bodies, on our shoes when we come into our homes. It's something that I think about a lot too. Thinking again, I do take a really strong focus on equity, and thinking about, why is this okay for some neighborhoods and not okay in others? Some of these tracts in Bayview Hunters Point have a higher concentration of waste processing facilities than 99% of other census tracts throughout the entire state of California, which is a huge state, right? We know it's huge. It could be a country. So why is that okay? Why are we all right with that happening in Bayview Hunters Point? And what do we do to prevent it from happening in other parts of the city or of the state, or term health effects? There's a lot of data available about health disparities and how that relates to Bayview Hunters Point, how much earlier in the life course you might expect to see somebody visit an emergency room, the prevalence rates of different types of cancers and asthma, even adult asthma, are much higher. And so, asking ourselves why is good to a point, but then when we look at maps and information like the data that was just presented, it becomes really clear. We don't have to ask a lot of questions. We might just pivot a bit to how we fix those circumstances and how our neighborhoods become more equitable. Because all of these things, just to go back to that main point, affect our brain health, our cognitive health, the brain processes over time. Thinking about human waste specifically and how that specifically might be a danger for our cognitive health, there's some data here about sort of how frequently we eliminate as humans and what that's composed of. And I think that's important because if you know much about human waste and feces, it's comprised mostly of bacteria, and we have different microbiomes in the body. So the nose, the armpits, many different parts of the body are considered different hubs of bacteria. And these bacteria are generally considered to be healthy for us. They help us combat disease and infection. And they have a number of different sort of functions. They also, these microbiomes also contain many harmful bacteria that, as long as they're sort of kept in check and kept in these places of our bodies where they're not spreading and not being activated, so to speak, they're not problematic. And like I said, it is helpful. But sometimes those bacteria come out into the environment and they can have very direct effects on brain health. And generally that's related to encephalopathy, so swelling in the brain. Oftentimes that is temporary. It may not have a long-term effect, like we think, of a dementia or Alzheimer's that is, irreversible and certainly is long-term. And you can't go for really a treatment, but many of these effects, luckily, are treatable. There are bacterial infections. And mostly this happens when we breathe in these particles, right? So if there's feces on the street and it's not cleaned up and it becomes aerized, right? So it dries and then those particles are kind of moving through the air, you can actually really breathe them in and be affected by them. And so that's not to scare anybody also. I mean, when we're outside walking around, we're definitely breathing relatively fresh air. The likelihood that you'll breathe in one of these bacteria that will have an effect on your health is probably pretty low, frankly, in these circumstances. But if we think of that person who is living there, who is living on that sidewalk or in the tent or in, a physical place that's very, very close to where some of these sources of waste exist, then their likelihood is probably much higher, right? And we have to think about that for long-term approaches to our public health, to financing hospitals and treatment. Ultimately, we're all inhabiting the same planet, right? So one way or another, it's going to affect us all. I think that we move on here to, what can we do? What's within our control? What might we suggest or propose? And how can we come together to mitigate these circumstances or improve them? In Bayview Hunters Point particular, there are a few organizations and sort of advocacy groups that do a lot of work around this, around environmental hazards, around raising awareness about what is in our communities and chemical toxicity and how things get into sort of the groundwater and can have effects years later beyond even what we have present in mind at the times that we're advocating or thinking about this. I would encourage you to think about, what groups or organizations might be working in this space in your home community. And if not, maybe that's not a really big concern where you're living, but it could be in a neighboring area or something that you could contribute to outside of your own personal interest, right? Like political advocacy and community engagement. Mary Harrison is a very well-known name in this. She did a lot of advocacy over the years for cleaning up waste, cleaning up toxic environments, and really showing through data and through stories how this was the slide about just a few minutes ago, right? So the point of defecating on a public street, so the loss of inhibition or disgust. And this is something that our team really is looking into in a very intentional way. The director of our community outreach program, who I think you may get to meet in August, we're thinking about how to have an in-person event where we can chat a bit and think about this together. But he is leading a research program here in the city that is looking at just this, right? And thinking about people who are experiencing homelessness and who may be living on the streets. How did they get there, right? Is it a mental health issue? Was it a drug problem? Was it a financial issue? Or is there some neurodegenerative process that's happening that's driving these changes? And an example I'll give is one of the sort of brain processes that is often evaluated at the Memory and Aging Center would be the ability to plan, right? So if I want to go on a trip or I need to budget my monthly finances, am I doing that the same as ever? Am I doing that poorly? Has somebody or have I noticed changes in my ability to plan? And there are memory and thinking tests beyond, self-report that would evaluate this. But thinking about sort of instability in the home or finances, if every month I sit down to plan in sense of budget and I make my bill payments, and then all of a sudden I'm starting to have trouble making these bill payments, and it's not because I don't have the money, and it's not because the bills didn't come in, I have them, but there's something else there making an effect, and I lose a payment, I miss a payment. That something like that, a very acute sort of one-time situation due to housing circumstances in the Bay Area in general, what we have heard from some of those who have been tested or part of these projects is that, one moment like that can have an effect that really pushes somebody into homelessness. And so is that, where they really just forgot, or maybe really didn't have the money to make that month's rent payment? Or is it that they're experiencing something neurological that may be preventing them from having sort of the foresight and follow through to complete that multi-step process and plan and get it done? Thinking about some of the bacteria stuff, there's a lot of information out there, and I'm also not a nutritionist. As I said, I'm an artist, but there's also a lot of scientific information that we know of about how we can produce changes in our microbiome and have a healthy, flora or sort of system of bacteria in our bodies. And there's even been research into whether fecal transplants, which are exactly what it sounds like, right? So taking a sample of feces from one individual or organism and transplanting it to the next, how strong of an effect that has in producing a healthy bacterial composition and changing the microbiome, and then sometimes even having effects that move to the brain or other health processes. And whether, some of our pursuit of sort of medication-based cures or therapies, certainly valid, certainly incredibly important, and possibly the only way we'll really end up curing or finding disease-modifying therapies for these conditions, different neurodegenerative diseases like dementia or Alzheimer's. There may also be other things like this that on the surface might sound unpalatable or weird, or kind of like, what are you talking about, a fecal transplant? But if you think of it from maybe a more holistic or curious or maybe even creative perspective, it seems to be a solution that has had some early promising results. So again, I just invite us to think about these things really critically, to keep in mind always that social connection and maintaining your social connections is one of the most powerful things that you can do to protect your cognitive health over the life course. As somebody who, and I'll say it very openly, struggles with social anxiety, and often through my work, I do a lot of person-to-person engagement, and then I kind of feel like I need some time to hibernate, so to speak. You really have to make an effort to push yourself to do those social things, to have conversations, to go out and connect, because it's not something just about that moment. It has a really long-term effect that can be quite profound. And the Lancet, I'm sure this is something that many of us have seen over the years. I don't have this graphic as part of this particular presentation, but, the reports are that about 40% of dementias are preventable through lifestyle factors. So, stopping smoking, eating a healthier diet, physical activity, not so much so that you look like a model, but just to have physical activity and be well, social connection, all of these things come together in a way that produce changes in the brain that we can control a little bit better by the decisions we make. So be curious, have some conversations, and get out in community if you can. And if you need some help doing that, our outreach program, I'm sure Louis and Dorla maybe have some contacts as well. There are a ton of great community centers throughout the Bay Area. Reach out to me over phone or email if you have some questions or comments. And I would definitely try to help you get connected because it's really important. With that, I'll say thank you one more time. And I don't know if there are any questions or comments, but that does conclude my presentation.